definitely see what we saw in late December and January. We're preparing for that.
Right now, there are roughly 1,800 people in Tennessee hospitals because of COVID-19. We want to show you this comparison. The orange line showing how that number has gone up in the past 30 days. The last surge in November is represented by this blue line here. And you can see the trajectory of both. Over the same number of days, that current spike in orange is going up a lot faster than it did last year. Last winter, it took 53 days for Tennessee to go from 1,800 hospitalizations to the peak, around 3,300. At our current pace, projections show we could hit that number in just 21 days. 10 News reporter Grace King spoke with UT's chief medical officer about how they are preparing.
At UT Medical Center, the COVID-19 section is filling up again.
We don't think we've reached that peak.
But this time, UT's chief medical officer, Dr. Keith Gray, says it's different.
We had testing constraints and PPE constraints. We don't have those anymore. What we have now is, if we continue on this trend, will be capacity constraints and also staffing constraints.
Dr. Gray says their staffing is affected by a lack of COVID-19 precautions in the community.
We have such a large percentage of unvaccinated people in the community. We have no gathering restraints. Few people are wearing masks.
Fatigue is playing a role too.
Our staff is tired. We've been doing this steadily for the last year and a half, and that starts to wear on anyone, especially those on the front line of COVID.
It's a tiring battle, but one that's prepared them for this new surge.
We have people that are familiar with treatment, familiar with routines for those patients.
A surge that's skewing younger.
The overwhelming majority in our hospital and what we're seeing across the nation is in unvaccinated patients.
Every day, Dr. Gray speaks with other regional hospitals to coordinate their response.
Between the collective capacity of our healthcare systems, we will continue to manage the non-COVID related illnesses of the people of our community.
And while he says it's not too late to change the hospitalization trajectory,
we always hope for the best but prepare for the worst.
I'm Grace King, reporting.
UT Medical Center says they haven't ruled anything out, including deferring non-emergent surgeries. However, they're trying to avoid that because of the negative impact it had last year. Now, while hospitalizations are rising quickly, so are vaccinations. The state says more than 80,000 Tennesseans received their first dose or only dose of the COVID-19 vaccine last week. That is up from just 25,000 people who began the process at this point back in July.